Martinez, a nurse practitioner who has joined the Gotham Wellness Clinic recently. And she's here to speak on women's health. And I think, we can see what's going on in the women's health, what's new, and what I want to do with the cancer screening for the females and everything. So I'll have Diane Martinez over here. Diane.
Hello, everybody. It's a pleasure to be here today. And like Dr. Gautam said, I'm a family nurse practitioner. And I just joined the Gautam office, and I'm privileged to serve this community. I'm going to speak about women's health and touch on reproductive problems and diseases, as well as heart disease. So I'll start with heart disease. In a women's health incorporates the whole spectrum of a woman's life. At each stages of a woman's life, there is preventative health care measures that need to be taken in order to prevent disease or to detect the disease early. So heart disease is the most common cause of death in the United States between women and men. Heart disease is one of these catch-all phrases that incorporates a lot of diseases like coronary artery disease that can lead to heart attacks. So the signs and symptoms of heart attacks are chest pain, palpitations, sweating, nausea, vomiting, pain that radiates to the left arm. But the presentation in women can be different. In women, some women may not even have symptoms when they're having a heart attack. They may have more like gastric upset, back pain, and they may ignore these problems. So naturally, sometimes most women tend to put others before themselves. So they may ignore these signs and symptoms, and they may brush it off, go to sleep, and they can die in their sleep sometimes. So, but I'm not saying that every woman that's having a GI upset or stomach problems is having a heart attack. So it's important to know the signs and symptoms and the risk factors and what we can do to prevent a heart attack. So the risk factors are smoking, uncontrolled diabetes, uncontrolled blood pressure. So people can live with uncontrolled blood pressure for many years and not have any symptoms. Obesity, inactivity, these are all modifiable risk factors, meaning that you can do something about them. So since you can do something about them, that means that they're, like, for example, high blood pressure, you need to know what your blood pressure is. You need to have your routine screens done, your follow-up with your primary care doctor, and have your blood pressure checked, have your sugar checked, or your A1C, which is the measurement of diabetes, if it's advanced or where you're at in the disease process. Also, quit smoking, exercise, make better food choices, reduce your stress levels, reducing them and learning how to cope with them in a healthy way. For me, it's exercise. For other people, maybe yoga, maybe meditation, whatever it may be, but learn to cope with these stresses in a healthy manner. And also we have non-modifiable risk factors, which are your age and family history. As we get older, the heart muscles begin to stiffen, and so that the heart cannot pump blood adequately to the rest of the body. So that's also a risk factor that's non-modifiable, because as we get older, we can't get younger. So, but there are ways to prevent and detect the problem and slow down the process of disease. Also, family members, history of family members that have had problems with heart disease earlier than 60 years of age puts you at a greater increase of heart disease. So it's important to know what your family history is, and also have your routine checks so that All this, it can be prevented or can be detected and put under control. Now moving on to breast cancer awareness. Breast cancer is the most common cancer in women in the United States. Breast cancer risk factors include family history of first-degree family history of breast cancer, cervical cancer, endometrial cancer, and ovarian cancer. So if that means your mom, your sister, your daughter, they have a history of breast cancer, then that puts you at an increased risk for breast cancer. Also genetics, your BRCA1, BRCA2 gene mutations, in a personal medical history or history of family medical history with this gene mutations. Age, breast cancer risk increases at the age of 60. It peaks at 70 and then declines after that. If a personal history of cervical cancer, also, endometrial cancer, ovarian cancer, you're at higher risk for breast cancer. Screenings can start as early as age 40. And if you have any of the risk factors that I just mentioned, your provider may want you to screen earlier than that. And then how often depends on your risk factors, and it also depends on your age. It can be one every year or every 2 years. That's between a discussion between you and your healthcare provider. So cervical cancer screenings. Cervical cancer screenings there's 2 screening tests. One is the pap test, the other is the HPV test. The pap test screens for abnormal changes in the cells of the cervix. The HPV test looks for the human papillomavirus if it's present, which can cause changes in the cervical cells and therefore can progress to cancer. So the current guidelines recommend that a woman start her pap testing at the age of 21, regardless of the onset of sexual activity. Between the ages of 21 and 29, you are recommended to have a pap smear done every 3 years. If there's no abnormality, every 3 years would be recommended. The HPV testing is between the age of 30 and the age of 65. And you can have what's called co-testing. Co-testing includes the pap smear and the HPV testing at the same time. And if there's no abnormalities found, it's safe to do it every 5 years. At the age of 65, if you have had recurrent normal pap smears, then you can safely exit these cervical cancer screening at that age. If you've had a hysterectomy, if you've had a cervix removed, depending on the reason why it's been removed, and if it's a history of cancer, then they may continue to do routinely pap checks, because HPV can also cause vaginal cancer. So, menopause. So menopause is the stage of a woman's life when she no longer has her period. The average age for menopause is usually at 51 years of age. You are considered to be on menopause when you have not had your period for 1 entire year. And before that, you may have had symptoms like irregular periods, hot flushes. That's the most common symptom in a woman. About 80% of women have hot flushes. Then the risk that for postmenopausal women can lead to osteoporosis. Osteoporosis is a medical condition that causes your bones to become fragile, and it predisposes you to fractures very easily. So the recommendations for osteoporosis screening starts at the age of 65. How often depends on your bone density minerals, or your bone mineral density. That's how much tissue you have in your bones. Depends on your age, depends if you are on current medication for osteoporosis, And that's also discussion between you and your provider that he will recommend how often you should have. And another thing that I should point out is that a woman that that's already been clinically diagnosed with as being menopausal, 6 months after, if there is any type of vaginal bleeding, then that is a red flag and that needs to be addressed with your healthcare provider, because that can probably be a sign of an uterine cancer. So any bleeding after menopause needs to be addressed. If you don't have a cervix, a uterus, then at that point, we cannot rely on periods anymore. If you've had a hysterectomy early on, then you cannot rely on that diagnosis, but they can certainly do a blood test to confirm the diagnosis of menopause. Now, for women, the postmenopausal women, the recommendations for calcium intake is usually about 1,200 milligrams of calcium a day, 800 units of international units of vitamin D to maintain good bone health, because naturally, when a woman goes into menopause, her ovaries don't produce estrogen or progesterone anymore. And naturally, estrogen helps to maintain bone health. So if your estrogen levels are low, then you are at risk for osteoporosis. That's why it's important, even out of every woman that's young, should be taking an adequate amount of calcium a day. Usually the preferred method would be in your diet intake, a lot of green leafy vegetables, salmon, sardines, fortified calcium orange juice. So that's usually the preferred method, but you can also take about 800 milligrams of calcium a day, and that's the recommendation. And I would just suggest everybody to know what their family history is, family medical history is, because that way we can also test appropriately. And did I talk about breast cancer? I did, okay. So, and that's it for today.
Thanks, Janet. So I think we're going to invite Leo. Is my physician assistant, and I think we all sometimes, like we had a women's health. I think so. Men's health, so we'll have a little bit of perspective on men's health. So I'll invite Leo to give some insights about it.
Hello, everybody. So I really didn't prepare any formal presentation, but I'll talk about men's health. So hopefully after this small talk, a lot of you will visit your doctors and talk to them, sit with them. On any doctor, you should establish one. So in my 12 years of practice, men, their excuse is, I don't want to go to the doctor, because every time I go to the doctor, they always find something wrong with me. Well, that's good. That means your doctor is doing a great job. So, the thing is, we have to find the problem as soon as possible before it can lead to, complex or more difficult health problems. Why do we do screening? So we can detect precancerous cells earlier. It could be removed and treated. If there is cancer, the sooner we find it, the better survival rate for a patient. It'll be easier to treat. So let's talk about the most common cancer in the U.S. So men, prostate cancer is the most common form of cancer. All right, so um, it's a simple test, pretty much. It's a PSA labs. Um, you really have to discuss that with your doctor. If he or she find you to have elevated prostate enzymes, uh, because sometimes there's a false positive prostate enzyme. Meaning it can be elevated, but not necessarily means you have prostate cancer. So, sometimes you get a prostate infection, prostatitis, and your PSA levels can be elevated. So that needs to be follow-up. Medications can increase your PSA levels. Um, you know, prostate cancer is a slow-growing cancer. So we usually stop screening at the age of 70. Okay. We start at age 55. And again, it's up to you and your doctor if you want to be screened for it, because a lot of the time, if you've been diagnosed with elevated PSA and then prostate cancer, they'll do this treatment, and sometimes you'll get some adverse reactions, that could affect your entire life, like, bowel or urinary incontinence, erectile dysfunctions. So you have to weigh your risks and benefits for that. Colon or colorectal cancer, that's like the third most common cancer in the U.S. So we start screening at the age of 50, right? There's different tests that we could do. There's stool tests, normal stool samples, send it to the lab. There's blood. Okay, we need to do further testing. There's sigmoidoscopy, colonoscopy, right, and CT colography. Those are all the tests. Again, we start at age 50, so it's very important you do that. If you have significant risk factors, like you have family history of colon cancer, or family history of colon polyps, or genetic problem or syndrome like the familial polyposis, you could start screening at age 45. Okay. Testicular cancer can happen in men. Women, we recommend them to do self-breast exam monthly, right? So men, you do the same. Do your palpate your testicles, make sure you feel for any lump or mass. Feel something, go see your doctor right away so we could evaluate that. Skin cancer, most common form of cancer in the US, right? Of course, we're exposed to the sun every day. So this is from UV rays or ultraviolet rays from the sun, or tanning bed or sun lamp or things like that. Usually the most UV rays is from 10 in the morning to 4 in the afternoon. So help, you can protect yourself by wearing a hat, sunglasses, long sleeve pants, and use sun protection, sunscreen. Usually recommended SPF greater than 15. So, all right. What are the things that you could do to stay healthy? It's always you always hear that from your doctor. Eat right, eat healthy. Don't smoke, right, or avoid secondhand smoke. Smoking is the worst hobby you could start in your life, lung cancer, definitely. If you don't get lung cancer, uh, guarantee you, if you are a heavy smoker, when you get old, you'll have COPD, and COPD is really tough. You see these people wearing oxygen because they can't breathe. So take care. If you are a heavy smoker, talk to your doctor, get screened for lung cancer, right? Usually a heavy smoker is 30 pack per year. That means if you smoke 1 pack per day for 30 years, you're a heavy smoker. If you smoke 2 pack per day for 15 years, you're a heavy smoker. So you're at risk for lung cancer, so you need to be screened. And usually they do a low dose CT scan of your lungs, all right? Hmm. Let's see, let's talk about some health problem. Okay, it's very important you go to your doctor and get some full physical, at least once a year, right? Get your labs done, make sure you're getting screened for diabetes. Because, diabetes, when you get symptoms, you're saying, I'm losing my eyesight or you're having a kidney failure, it's kind of too late already. Diabetes is also a risk factor for heart disease. So get your simple lab, A1C, fasting blood sugar, get it checked. All right, sit down with your doctor, and sign a treatment plan for you, and that would be good for you. Um, Good control blood pressure, right? Um, Same thing, you could have a blood pressure 140, 90, 150, over 100, and you really don't feel anything. Your body's so used to the high blood pressure, you don't even know. But over time, when your blood pressure is always high, it's not good for your heart. You're stressing your heart. So, yeah, make sure you check your blood pressure. Always discuss that with your doctor and see if you need to be treated or not. Limit your sodium intake because usually that contributes to high blood pressure. Eating healthy, right? Avoiding those bad fats, trans fats, saturated fats, high cholesterol food. Um, Eat more fiber, fruits and vegetables, a variety of that. That's better for you. Um, okay, one more thing I want to talk about, which is usually when the man gets hit with this, everything is, you're really gonna feel bad. So you're feeling, fatigue, weakness, you don't have the energy, you're irritable, you're, no desire, no sex drive, no desire to exercise, you're gaining weight, feeling depressed. You want to talk to your doctor, check your testosterone levels, okay? Um, because you could have low testosterone or hypogonadism, which basically means your gonads, your testicles, not producing that testosterone. So, uh, to treat that, your doctor needs to uh, probably do a testosterone therapy. There's different testosterone patch, gel, or shots. That's fine. Um, and when you have low testosterone, you can be at risk for osteoporosis. Yes, men can get osteoporosis, and we start screening at the age of 70. Um, Basically, osteoporosis, like Diane said, it's basically you have a weak bones. Okay, so there are different treatments. Basic one is calcium, vitamin D, and staying active, doing physical activity. Keep moving. But if it's pretty severe osteoporosis, you might need other medications. Okay, there are different medications for osteoporosis. I think that's pretty much it. Just see your doctor, get some check, get screening done. It'll save you. Thank you.
And I will have, thanks Leo, I will have Dr. Dijon, is a cardiologist, so I think, it's nice to know everybody has heart problems, whether it's males or females. So I certainly would like to know some simple health tips for the heart wise. I mean, what can you do, simple thing? And being in cardiology, we're dealing with the heart, and he recently came back from a conference, so I think he's got some nice thoughts to tell us. I think we'll enjoy that. Dr. Dijon, the cardiologist.
So after eating, I usually feel tired, and you guys probably feel tired also. So if you want to snooze, that's fine with me. What Diane and Leo has talked about today is basically screening and preventative care. Why do we do that? Well, heart disease has been around for years. Cancer has been around for years. Okay? All diseases have been around for years. Why are we so gung-ho about doing screening exams? Because a bunch of smart people beyond me found a way. If so many people have this problem and they're dying of this or having complications, shouldn't we do something to prevent that? We know how to treat it. Part of the time, treatment is not a good option because the treatment may be bad for the benefit of the patient, but should we do something to prevent what we're going to go through in a couple of years? And that's what preventative screening is about. So there's a family history of breast cancer, get screened. If there's a history of prostate cancer, you should be screened. Colon cancer is the #1 cancer for most people, men and women. Heart disease is not any different. Heart disease, everyone has heart disease. We all, past the age of 40, we will develop the beginnings of heart disease, no matter what. But the thing is, with heart disease, it's insidious. It's a long, drawn-out process. You're not gonna feel anything. When people have blood pressure problems, it doesn't hurt. The first sign of blood pressure is a stroke. Actually, the first sign of blood pressure is a heart attack or death. So, is there any warning signs? Say, well, what's my warning sign if I'm going to have a stroke or a heart attack? There's no warning sign. So if you have someone coming in here with long-standing blood pressure, uncontrolled, there is a 99.9% time that there's going to be changes to your body and your heart, no matter what. So should we hold out the past so we don't have to go through a stroke or a heart attack? Makes sense to me. What Diane said about screening, about heart disease, they ask you, oh, do you have high blood pressure? Do you have cholesterol? Are you diabetic? Do you know where that comes from? 70 years ago, this one doctor, the cardiologist in Framingham, Massachusetts, decided to follow the whole entire town, from toddlers to the advanced patients elderly, and follow them for all this time. It's a longitudinal study. He's dead. He died about a couple of years ago, but the study is still going on. That's why it's longitudinal. It'll still go on. And from the data collected from that study, we found out if your blood pressure is not controlled, 9 times out of 10, you're going to get heart failure, strokes, and heart disease. If you're diabetic, you have a 90% chance of having complications of your diabetes compared to patients who are non-diabetic. If you smoke, you have more chances of having these problems compared to a non-smoker. And out of that study, the Framingham study, outshoots of other studies have gone by in the development and treatment of heart disease. It's no longer called cardiology at this point in time. They're calling it cardiovascular medicine. That not only deals with the heart, but you're dealing with the vascular supply to any organs. Any of your arteries that supply your organs, kidneys, lungs, liver. If you've got disease, those organs become affected, become dysfunctional, and people have complications from that. That's why you're thinking, rather than call cardiology, why would you say cardiovascular medicine? It encompasses the whole entire gamut and spectrum of cardiovascular disease. So when your doctor says, Maybe, you should not smoke, or you should stop smoking, or lose your weight, take your blood pressure medications. There's a reason for that. They're not telling you. I like to say they're advising you, and you can decide what to do from there. As a well-informed patient, that's your prerogative to be well-informed. You don't have to listen to what I say. I tell my patients, this is the reason why you do it. This is the side effects of the medication. But in the long run, if 100 people are on this medication, and they stay on that for 5 years, and we see those 100 people, 50 of them are still alive, doing well, maybe the other 50 have passed away. Maybe that's the benefit of being on the medication. These are all the studies that they just show. So, not every specialty, every group, professional group, has screening guidelines. Cardiology or cardiovascular medicine has the most screening guidelines because cardiovascular disease is the #1 cause of death and complications in the Western world. Third world countries are starting to catch up now because they're starting to get industrialized before they weren't. So, seeing your primary care physician is the first step for screening. If you find something that is abnormal, then it would behoove them to send it to the proper specialist or physician that would deal with the abnormality. So there are a lot of times that I've seen a lot of patients referred to me by other physicians like Dr. Gotham, Leo, or whatever. And they're simple stuff like, oh, I see this abnormal EKG, what does that mean? Could you look into that? Well, and that's the next step I do is see, this EKG shows this certain problem. This might be the reason. We need to work it up from there. So, and let me tell you what Dr. Gotham said. The American College of Cardiology has been an entity for over 100 years and has set the guideline in association with other societies like the American Heart Association in terms of how to manage, treat patients with cardiovascular disease. Every year they have their scientific conferences across the country. They had the recent one in New Orleans where they talked about the landmark studies and everything. And I'm going to tell you, I feel like a geek, but there's an exciting time for being a physician, especially as a cardiologist, because there are other modalities and treatment options that people did not have before that could greatly benefit and change your lives or so. The minute everyone in this room affords a certain quality of life they enjoy. The minute that you cannot have that quality of life and it has changed drastically, say breaking your hip and you cannot walk anymore, having a stroke and you cannot walk or go to the bathroom on your own, or having a heart attack that has damaged your heart that you cannot do your activities, that is a drastic change in your quality of life. And why would you want to go through that? And if there's any reason that you can prevent that, by all means, we should look into that. So the take-home point is you have to become a well-informed patient when your doctor says, I think this is what's going on, and you have doubts, you should ask. There's no harm in asking. Okay? If your doctor doesn't tell you that, then you should find someone who should let you know. Sorry, go ahead.
Exactly what is high blood pressure? Why does exercise? And how much of that is genetic?
Okay. In a nutshell, I'm going to give you physiology 101, okay, in a nutshell. Your heart is a pump, and all the vessels is the conduit. It's a closed system pump. So in order for your heart to pump blood to the rest of the body, you have to have a certain pressure, because your heart's going to pump a certain amount of pressure to propel the blood, and you have to have that resistance to keep the blood going, and that's your blood pressure. And if your blood pressure is higher than the resistance of that blood pressure is higher than the heart can pump, it's going to reflect back to the heart. And the heart saying, what the heck is going on? How come I have this high pressure? I'm pushing things out. And it's going to compensate by accommodating for that high blood pressure. It will work, but over time, the heart's gonna falter because they cannot handle that pressure for a long time. And it cannot handle that pressure, it's gonna fail. And that will be, and compound that with people having other factors like diabetes and smoking, it's gonna even affect the blood pressure. The pressure is a resistance the heart has to overcome. It's not hereditary, but there are certain episodes that your family has blood pressure, and the older we get, your pressure's gonna go up no matter what, okay? I'll be 54 next week. I've been on blood pressure medication since I was 18 because it runs in my family. My two brothers who are physicians also have blood pressure, and diabetes was in my family as well. My youngest brother, he has diabetes. So my feeling is there is maybe a hereditary component. It's not genetic, it might be something genetic-wise, and that's why you're doing the human genome project and everything. But look at the factors. As we all grow older, these environmental factors affect our bodies, no matter what. And as I said in the earlier lecture with the school kids here, your heart's been pumping since you were born. So the engine, you can't replace it. Oh, you can replace it. We usually do heart transplants. But to have a heart transplant is very rare and very costly, and it carries a high risk. So it's best to tune up your heart, like tune up the engine as best you can. So does that answer your question?
Well, the third part of it was, what is exercise?
Oh, exercise over time, as you exercise, the heart adapts to the higher pressure, it pumps more effectively, and as the arteries constrict with exercise, they sort of relax, so they go hand in hand. So it's beneficial to keep the heart healthy. So that's all I wanted to say. Again, you need to be well informed. You need to ask questions. If you cannot get the questions, you got to find someone to answer those questions for you. They may not, my patients say, well, I have this question. And I always say, well, I don't know, but I can damn sure find out and let you know. Thank you.
Thank you, Dr. D. I think, go ahead.
We have another group. I just didn't want to.
Sure.
Because we have another group that's available to present kind of a mental health and that. So
Oh, great. That would be very nice. Okay, so I think, how do we, so we have some here speakers to talk about the mental health and everything. So I think it'll be very nice because we all have some kind of little bit of disbalance of the mental issues. I would say, or health, I would say, with that. I think there's a joke I heard a few days ago. I went to this conference in Los Angeles Convention Center. So one of the big spiritual leaders, and he's a yoga and a spiritual leader, well known in the entity Sadhguru. So he was at the LA Convention Center giving a big lecture about the yoga, the meditation, and all that spiritual thing. And I saw Richard Gere was there, and Angelina was also there, the movie star. So they were there, and he had a joke that everybody now, in the old time, mental health was like, okay, if you have some issues, then it's an abnormal. Now, if you have a little bit of mental problems, stress, anxiety, depression, it's considered normal. So a doctor, went and was sitting, and his patient comes in and says to the doctor, "Doc, I'm suffering from mild depression and this and that," and he, say, "Okay, examine the patient," and he doesn't give. "I'm suffering from mild depression and this thing." He says, "Normal nowadays. So you don't need anything. If it becomes really abnormal, then I'll certainly do something for you." So welcome aboard, and please help us out.
So today we actually have a little bit of a treat. We have Alan Hyde and a group of people that he works with. Alan is actually an alumni of Marshall College, played baseball for us. And so he kind of worked with our student athletes earlier this morning on a mental health workshop, kind of one-on-one with them, and is looking basically to give back to the communities that he came from. He also went on to play at University of Laverne, has done something similar there. So he's actually since has gone on and gotten involved in mental health practice and is a licensed marriage and family therapist. And so come on.
Hello. This looks about right based on my experience when I went to school here. This kind of small campus, small field. I'm going to actually pull away the microphone. Can everyone hear me?
Yeah.
The live stream probably won't hear you.
What was that?
The live stream won't pick you up if you're not on the microphone.
You got it.
So you can take that off if you want.
So I love this joke that the doc was bringing up of, it's normal these days. Things like depression, things like anxiety, things like bipolar and rapid cycling, things like mental health struggles in general and the emotions that we experience every single day, day in and day out, whether I'm working with primary addictions, primary mental health, schizoaffective, people responding to stimuli that aren't there. I assure them and remind them that their community connection is what's going to help them work through their mental health. It's what's going to help them seek the help that they need. I'm that community. Doc is that community. All the doctors that came up here and shared with us to get the screenings, the nurse practitioners, the individuals that I brought with me here today, the life coaches and the individuals that live in the treatment houses with these people. It's normal. We're going to struggle. I've come to find over the last 10 years that from living in the high desert, growing up in this place, getting arrested in this place, coming to school at Barstow Community College, falling in love, and changing my life was a combination of three things. Number one was mindfulness. And when I share this term with communities such as this, I get the, ooh, that's trending right now. And it makes me laugh because mindfulness has always been trending. Living in the present moment is something that we should all be trying to do and that we all kind of struggle with. And I'm not talking about things like meditation or sitting in a dark room and lighting candles. I teach those things too, but what I'm talking about is an awareness of our emotions in the mindful present moment. By actually sitting with our emotions and honoring them, like Doc was saying with the joke that was shared, is it's normal. We're going to feel. We're all going to feel, and that may be unique to you. You may have a unique presentation of that, and that's okay. But mindfulness is about sitting with that pain, sitting with that emotion, being curious about what it is that you're experiencing, checking in with your bodily sensations, checking in with your thoughts, your behaviors, and your feelings. And by doing these things and being mindful, it will lead to what the doctors are asking you to do, get the screenings, be aware of your experience so that you can get the help that you need, not just medically, but emotionally. Once we have this mindful awareness, raise your hand if you've ever felt so down, sad, depressed about things that happened in the past, or maybe guilt, shame, and we dwell on it. Am I the only one? So anxious, worried, fearful, or afraid about things that could possibly happen in the future, but haven't happened yet, and we dwell on that. And doing either one of these two things and dwelling on for too long takes us right out of the mindful present moment. And so what we have to do is get our screenings, honor our emotions, talk with a therapist. That's why I came out here today to talk to the teammates and talk to the student athletes that come behind me at this wonderful school, is to remind them it's okay to talk to people about what we feel, talk to people about our human experience, talk to people about what we can do to move forward. And so to pull ourselves back into the mindful awareness, here right now, we got to listen to the doctors and what they're telling us. We got to listen to the therapists and the feedback that we're getting. And know that we bounce back and forth in these mindsets of being anxious and depressed. To whatever degree, we're human. We're all going to experience that. We all raised our hand. This is a very validating experience. And that's part of mindfulness as well. It's identification. We just identified some feelings in this room. Then we describe, and that's what doctors can help us do. That's what therapists can help us do. Let's put words to it. And then validate. And I'll tell you what, it's validating for me when I look around and I see people in a community saying that they've gone through very similar things. We've got educated doctors that are going through the same exact things that we all go through as well. It's validating. We're human. The second is self-love. It's something that I talk to the guys and gals about today, something that I struggle with, even when I went to school here, is to look myself in the mirror and say things like, I love you, or I'm worth it, or I have value. I think there's something very special about that journey and our ability to do that, but it takes time. It also requires us to be aware that we're not doing that all the time. Maybe you are, I don't know. But I want to encourage you, and I didn't really prepare anything necessarily to say too in-depth about self-love, other than to say it's okay to look yourself in the mirror and say, damn, I look good. Right? Or that I love you. Because we can't know love for another person in our community. We can't know love for anyone until we know what that feels like for ourselves. When we know what love feels like for ourselves, we start to model that in our community. We start to become a safe person that people can talk to. We start to model for other people what it looks like to walk a safe path, to walk a confident path, to walk a path and not feel stuck bouncing back and forth between our anxiety and depression. Self-love is something that can be very powerful. It's something that can free us from the shackles that we experience in this life and our emotional pain, if you would. And it really does start with, and this is maybe the only exercise I'll give you today, is to wake up in the morning and look yourself in the eyes, in the mirror. And if you can't say I love you, I don't blame you. I work with patients every day on this. And I'm not talking about just struggling with substances. I'm not talking about just struggling with primary mental health. I'm talking about just living their life, coming and talking to a therapist. And it's uncomfortable to say I love you. And so I want to encourage you to just maybe say, hey, I'm okay with myself today. Or I'm going to enjoy today and I'm going to be present for this. Let's have some fun today. Let's live this life. And encourage yourself in that way. I want to just kind of ask you a question. You remember the first time you were ever in a relationship and one of you said, I love you for the first time? Remember how scary that was? How maybe uncomfortable it was, or the butterflies and the bubble guts, right? This is the same process. I gotta laugh, bubble guts. This is the same process when we start to love ourselves for the first time. It may be uncomfortable, it may be awkward, it may feel scary, but that's by design, because it's the most important relationship you're ever gonna have. And trust me, you are reaching out for yourself to love yourself. No one else can know your needs the way that you can know them on an intimate level. We go through life and we enter relationships and we expect other people to meet our needs. We ask them to meet our needs and then we get pissed off when they have no idea what we're asking for. And what I want to highlight, just from a clinical perspective, if you will, is that we understand what our needs are, so why we're asking for them. And so if we know what our needs are and we know how to ask others for them, why can't we provide for ourselves that need? Why can't we provide ourselves with that level of love that we're looking for in others? And so I want to invite you, encourage you to love yourselves. And when you do that, like I told our athletes here at the school, when you do that, you will genuinely allow yourself to connect to a community in a powerful way. You will genuinely be able to take your ideas, your passions, your desires to a community and lead the way. Not for them, not, to fix anybody, change anybody, but to be there for yourself. I mean, we can all do that individually. There's like 11 of us in this room, 12 of us in this room. It's more than enough. It's more than enough. I tell my patients one-on-one, I'll be your community. Not to fix you, not to change you, not even to help you. Because that's a common misconception of therapy and doctors. I can't help you if you don't help yourself. I can't walk this path for you, no matter how educated you are or uneducated you are. I can't walk this path for you. You have to walk it. You have to help yourself. We're not here to fix ourselves either, because that's self-hatred, viewing ourselves as broken or not what society wants us to be. That there's something broken in me and I have to fix it. I say, good. We're all broken in some way, I guess, if we think of it in that construct. we're good. So it makes us human. So it makes us unique. It's what allows us to connect. And I think if we can bring these pieces together of showing ourselves compassion, empathy, we can connect with our communities the same way that I have chosen to do with this school, the same way that they chose to do with me this morning. And we can be a little bit kinder to ourselves. And if we do that in the mindful present moment, we'll be able to go and sit with a doctor and hear the feedback they have for us and actually take the steps, actually live a healthy life. It's functional, it's beautiful, in our own unique way, whatever that means to us. And I'd just like to encourage you to do that today. Thank you very much for letting me come back to this beautiful, wonderful school to change my life. And doctors, thank you very, very much for letting me share this platform with you. I brought some buddies with me, Mariano and Aaron. I'm going to let Mariano go first. Mariano is a life coach. He's also on my board of directors, a nonprofit that I run where we provide mental health services. I'm going to turn it over to whatever you like. Awesome.
Good morning or good afternoon.
You're good. Let me turn it down a little bit.
All right. I talk pretty loud, that's why. Good. Cool. Awesome. So what's up, everybody? Good afternoon. My name is Mariano Padilla, and this is my first time out here in Barstow. So this is all very new to me, and I want to thank Alan for inviting me to come out. And since we're talking about mental health and everything, a good topic that I really want to share with you guys that I really learned from one of my mentors, and I've been applying this into my life for the past few years, is what we tell ourselves over a period of time eventually becomes a reality. Whether you believe it or not, it's very true. Thoughts do become things. And for example, a lot of people, because of the thoughts that we think, we legit put a lot of limitations within ourselves. Therefore, oh, I can't do that. I'm not good enough to go do that. It's the same thing. We lack the self-love, kind of like what Alan and I was talking about there. But since we're lacking that, we attract that into our lives. I don't know if a lot of people here believe in the law of attraction, but I don't get too voodoo with it. But I do believe to a certain degree that we do attract and draw certain patterns within our life. Like if something happens to us over and over again, we attract getting involved in a bad relationship. We attract going bankrupt within our own bank accounts. It happens within our life. And because we constantly think that, even if we don't tell ourselves that, we're thinking that, we're drawing that same pattern over and over again. And in order to change things within your life, one, you do have to change your thoughts, but two, you also do need to change your habits too. And one of the best things that I ever learned, if you want things in your life to change, you have to change things within your life to change. And it all comes down to, I like to think of this acronym, APW. Oh no, ADW. So A means like we can always control our attitude. At the end of the day, no matter what the situation is, we just got to come to within ourselves and see, okay, this is where I'm at. This is what I need to change. And then how we carry ourselves upon that situation. Number two, D, or detail, how we go about it. I'm a big believer of like being a little analytical about it, but coming around like what details do we need to do in order to get through the situation. And then W, work ethic, getting through what you need to get through. It could be like going to the gym. A lot of people struggle with fitness, and that's something a challenge I personally have taken on. So I'm on day 22 for this Andy Frisella challenge right now. No cheat meals, work out 2 times a day, and drinking 1 gallon of water every single day. And because of me doing that challenge, it's working out for me, and I'm having so much more clarity. But it could be something different for you. A lot of people, it could be waking up earlier. It could be going out for a walk after you eat a big meal, so that way you get your digestive system going. It's little habits. And as you do those little things over a period of time, eventually it's going to compound into the effect. And I thank you guys for taking the time to listen to me. Thank you all for inviting me, and I'm done for the day. Cheers.
Hello again. So Mariano, we played baseball together at the University of Auburn. This is a guy who holds me accountable. So you know, when he's talking about these just kind of like skills and life and things like that, I've watched him walk with people and motivate them and really shake things up. And I was telling the guys earlier, this kind of guy is who you want in your corner. So thank you for coming out here and just spreading that value. This next guy I'm going to bring up here, his name's Aaron. He helped me out this morning, Aaron Villagomez. He helped me out this morning with the guys over there, the athletes and the girls. And I'll tell you what, you know, we worked in treatment together, what, 2.5 years ago? Yeah, and we stayed in touch ever since. We work with difficult patients, addictions, primary mental health. And when Aaron and I were working together, we worked in a residential home. And Aaron was in that home 8 hours a day, 5 days a week. And the guys and girls trusted him. They cared about him because he cared about them. And when I do these things, when I come back to my alma mater and get back to the athletes and talk to them about mindfulness and self-love and community, I remember that I've got a guy in my corner, not just in Mariano, but in Aaron, that is vulnerable and he walks in that path. And he's open about his emotions and he shares what he feels. And I wanted to bring him out here today to kind of just have a chance to speak on a forum, to be open, to model for us again what I get to experience from a real close friend, what vulnerability looks like. So I'm going to turn it over to him to come over here and speak to you guys for a few minutes.
Good afternoon. Yeah. Wanted to thank Alan for inviting me to his old alma mater, and it's also my first time here in Barstow. I passed by it a couple of times. My first time actually being here, so you know, definitely different, but I'm liking it so far. Alan has touched on the clinical side of mental health and drug and alcohol use. I wanted to touch on more the operation side, where I personally have worked in for most of my time working in. I've worked in the mental health and drug and alcohol sections, say now going on my fifth, sixth year. I've done and seen it all. It's definitely something that it's really hard to explain, but it's more, I want to just paint that picture of what it looks like to be working and just overseeing the day-to-day operations of a mental health and drug and alcohol treatment center. You work with different personalities. They have sometimes dual diagnosis. They have more than just one issue going on. And just to balance all these personalities, it takes a toll on you sometimes. And it's more than what you think, definitely. And it's made me a better person. Just when you walk into those doors, you get a sense of just a chaotic environment, and even before your shift even starts, you have your own issues that you have to deal with. And the important thing to do is to take a back seat and put your own personal issues to the side, and have the client issues become yours, because you can't help yourself. How are you going to help somebody else? Their issues become yours. That priority is them. And just working directly with the clients right there in the trenches it's a life-changing experience. Just hearing their war stories and what they've gone through and the stuff that unfortunately has happened to them. You know, it's heartbreaking sometimes. I mean, you just have to be that role model to them that they've never had, and to show them that life does eventually get better, and that whatever they're feeling at the moment is temporary. But things eventually they grow, and it doesn't stay dark forever. And just to finish up. Sometimes I like to challenge them. I like to get them out of their comfort zone and get them to do things that they're not comfortable doing. And then today, I put myself in that situation. I'm obviously not a public speaker. I'm very uncomfortable in this kind of atmosphere, but I'm doing my best. I'm pushing myself and I'm showing them that, hey, you know, I can do that too. I can put myself in another position and show them that, hey, you know, it's okay. That it's okay to be uncomfortable. That it does happen. That it's going to happen. And it's going to make us a better person if we have a plan. So, just wanted to thank you all for being patient and just letting me share my experiences and just what I've seen in treatment. I too found myself at one point finding myself being in the wrong crowd and hanging out with the wrong people and doing things I'm not supposed to be doing. And I felt if I stayed in that environment, I too would have found myself as a client rather than a person that's working directly with them. And I'm glad that I found that early in life, and I didn't stay in that environment. I took myself out as soon as I could, and I stayed in college. I too went the the community college route, because at the time I was just not ready to commit to a 4-year university. So one of the best decisions I made was to go to a community college and do my 2 to 3 years there, and then transfer and got my bachelor's degree in psychology. And so far that's been the highlight of my life, getting that degree. And it's only the beginning. I want to eventually go back to school and get my master's. Still don't know what I want to do yet quite yet though, but definitely I definitely want to do something in this field. I do enjoy it, and I'm only just continuing to grow as a person. So sky's the limit, and I'm glad I have Alan in my life to show me the right path and to help myself, and just continue to do more things like this to get myself more motivated, get that self-confidence, and just keep on doing what I'm doing, and I think everything will be okay. Thank you. Thank you.
Thank you. It was very nice. I think it's very important because when you are going through the stresses of life and you are into this situation of stress, anxiety, depression, you're feeling like that you're not able to cope with the environment and your life as a kid or young or adult, teenager, and that. So I think it becomes very hard. And I think at that time you are looking, how can I get help? Books are not of help. I mean, unfortunately, you can listen to the videos and all that stuff. They are also not much of help, because books, what will books kind of a thing is that. So I think when it comes to that place and time, you're looking at how can I help myself. And at that time, I think communicating with peers or people of your age group who have gone through the problems or there to help you out, I think you kind of went easily out, you kind of relate to them. And I think the exchange mechanism is very good, because answers are not in the books, answers are not at the physician office, to be honest. Either you go to a psychiatrist or psychologist or a regular physician, they don't have answers to this question, because all they can say, well, you do this, do that. But I think person needs more tools and techniques on a day-to-day basis and on individual events, and what to do, what not to do, how to think and everything. And that's like a deep going inside and helping them out day to day with that kind of process. As you said, you spend 8 hours, 5 days sitting there. That is how it takes sometimes that much of energy to spend to change the life of these people, to remodel them, to transform them to a positive career. So it's a very hard thing. It's not an easy track. it takes a lot of your energy. I mean, it's very easy to give them medications. And I see sometimes patients in the clinic with a depression, anxiety, and it's very easy to go and ask for a doctor for medication. But I think, I also do in my clinic the same thing. I spend a lot of, first time when they come 1 or 2 times, I spend a lot of counseling time. Don't give them any medication. And I try to work out with counseling if we can help them out. So I think it's a very, the communication and the opening that way. The only place is that we have organizations like you have a non-profit organization, you guys are doing that. So if we have more of those in every community, even if we have one organization in the community to do that, I think there'll be a great impact on the community and helping the people out. I think we need more of that in the organization. So I really thank to that you guys are doing such a noble job. So hats off to you guys. I will, I think, I want to have, I think we have in our wellness program, we have started here in the community. So we do some kind of exercises, yoga and all that stuff. So I think I just want to bring a little bit about that. And I will have Naomi ma'am to come out and talk about that. So,
hi, everybody. Hi. So, everybody stand up. We're gonna warm up just a little bit. Wow. Are you ready? Breathe in, inhale, reach for the sky. And then exhale, let go. Check everything. Nice. So, we are ready? Yes. Nice. Everybody have a seat. I'm so happy to be here today with you guys. And I'm here to talk about 2 different groups of people. We have this group, it doesn't matter how old they are, the economic situation they are, if they have equipment, if they have a time or not, if they have an arm, a leg, or whatever, they find the time to work out. It doesn't matter what is in their lives, they still have the time to work out. And then we have another group. They're looking for excuses and more excuses and more excuses to not do it, to not get the opportunity to have a better life. It's not just the way you look, it's your life. So one of the big excuses is, I don't have time. I don't have to. You don't have to have time. And you schedule, because I know everybody's working, everybody's going to school, everybody has kids, everybody has like 1,000 things to do. You can wake up 50 minutes before you usually wake up and use that time to do your workout. It doesn't have to be for an hour, 15 minutes of your time. That's what it takes. You're gonna park your car far away from your job and you're gonna walk. That's another 10 minutes and you get your workout. You go back to your house and then you cook in your dinner. It's gonna take 10 minutes to cook. You can do some exercises while the dinner is cooking. So I think time, it's not excuse. Everybody can find time to do it if you really want to do it. There is a movie playing, it's more than 2 hours, and you go. What it means? Because you want to do it. So you really want to work out, you're gonna find the time to do it. It's not an excuse. Another big excuse that I always hear is, I don't have money to go to the gym. I don't have money to buy equipment, and I don't know how to do it. You can do 1,000 exercises in your house. You don't need anything. The only thing you need is your own body weight, and that's it. And then if you have any questions about how you use your own body weight to get a great workout in 10 minutes, talk to me after this. I'm so happy to help you, because you can really get a really amazing workout and results just using your own body. So it's not an excuse either. You don't know how. There is apps, videos, personal trainers. There is 1,000 opportunities everywhere that you can take. So you have a question, you can ask me, and you can ask somebody that you feel comfortable with, and then we can gonna teach you your form and stuff so you can be healthy and don't hurt your body. Another thing is, and there's more girls that I hear saying, I don't like to sweat. I don't want to get dirty. If you're not sweating, when you exercise, and there's something really wrong with you. It's like, I'm sorry you had to go and talk to the doctors because sweating is normal. It's part of your body. It's part of how we are. And you have to see what medications you're taking. Sometimes that is important, and which one. You have to see if you don't have any that disease or whatever that is something that is holding you for not getting results, because there's another one. I go to the gym for 1 week and I'm still weighing the same. I look the same. You don't put all that weight in 1 week. So it's a process. And you have to be step by step. The way you put it in is the way it's gonna go up. So if you're consistent, it's gonna happen. It's not gonna happen in 1 day, in 1 week. And then yes, if it's a long time since you exercise, yes, you're gonna be sore. But the more you work out, the more you exercise, your muscles are gonna get stronger and you're gonna get better. And that thing is gonna reduce. So it's not excuse. And then I have another group that says like, I used to be super healthy. I used to be like, oh my God, I work out every day. I look amazing. I was eating right. And what happened? One day, I started eating bad, and I feel like I don't want to work out. And that day turns to a week, and that week to a month, and a month to years. Don't let one day, one bad day to destroy you. Have a plan. If you really want success, you have to make a plan. Little goals. Reach your goal. Have something fun for you. Try not to eat, because obviously we're trying to be healthy. So if I saw these shoes that I love, I'm gonna go and buy it. And I'm gonna have like time for myself or whatever. Do something nice for you, so you can keep stronger and reach goals. So there is no excuses. And the difference between the people that doesn't matter what happened, they keep it strong, and the people that just looking for excuses, it's right here. It's your brain. If you're strong right here, everything else is gonna follow. If you already give up right here, everything else is gonna give up. Your body's not gonna respond. So please, don't lie to yourself. Don't lie. If you really wanna be unhealthy, it's better to say, you know what? I don't care, I don't wanna be healthy. But don't lie to yourself, because you're not lying to anybody else. You're lying to yourself. And that's really sad. And if you are part of it, in my case, I wanna be healthy, not just for me, for my kids too. Because if I'm active, most likely my kids are gonna be active. And then my grandkids. It's a better future. It's a better community. It's a healthier community. So we don't have to talk about diabetes, heart attacks, and all these topics. So I just want to say thank you for being here. And then, like I said, you need any help, just come and see me.
God, so to speak.
No, nothing.
No, I think it's it's very important that in the mind is the most important thing. So I was listening to some today, one of the on the YouTube. Every morning I do like listen to some thoughts from people, and I think there was one thought which was coming was like a mind. Mind has 9 layers. So the mind is made up of 9 layers. So first layer, second layer, third layer. The 9th layer is the center of the circle. the first mind, the initial mind which we talk, is sitting at the outer of the circle. And that is why when you tell somebody something, he says, oh yeah, I understood. I understood. I understood means the mind, which is the ninth mind outside, understood it. 8, 7, 6, 5, 4, 3, 2, 1 have not understood it. And that is why that ninth mind, when it understands it, after a few minutes or after some time forgets it or goes to sleep. And that is why when the repetition of the things, same thing comes over, that mind from ninth mind switches to the 8, 7, 6, 5, 4, 3rd, and goes to the first mind. When the first mind gets it, after all the minds get sleeped, because once the mind grabs it, after some time it will go to sleep and give it over to the second mind. And so the inner mind, the last mind, when it gets it, that is when your concept becomes very, very strong. So these are all 8 minds which are called the filters. So once you take the same thought and filter through the 8 mind, you will see every time it goes from 9, 8, 7, 6, 5, 4 thing, your thoughts are changing about that thing. You're getting more deeper and deeper and deeper and deeper about it. And that's where it says that once you get to the center mind, which is a very first layer of the mind, then it becomes very concept, strong thought, like you're ready for it and you will not forget it. So I think the mind is the most important thing, but we are dealing with the superficial mind most of the times. And the whole process to get to the deeper mind is, how you work your mind, how you meditate, how you kind of start, analyzing your minds and everything. So I think that's, I always feel mind. I think if mind is strong, we can do everything. So, and as we, those, you guys, have saying that, because minds are weak, so superficial mind is taking that under knowledge. Superficial mind is not able to make any decision. It's very important. Superficial mind cannot stabilize anything. It's very superficial. It is only the first mind, when it gets the information, will be able to stabilize it. But the time taken from the ninth mind to the first mind, which you are helping him, the process, the understanding that person who is going through anxiety, depression, after you spend that much time, that is the first mind which grabs the information and able to give the final output on that. So I think mind is very important to understand. So, I'll take any questions anybody has. We don't have more speakers to speak, and I think so. Any questions?
Touch on that. Because we have these conversations in our society, especially in the Western society. Do, accomplish. Even when it comes to conversations like staying in shape, and I love that you talk about how important mind is. Because we start to restructure, and really push for the things that we want in our lives. Try to be okay with the process of living our lives. We really have to get to the place where we're okay with it. So that we get to that innermost part of our mind, that true identity self. And be okay there. So, like what we were talking about, mindfulness and self-love and getting in touch with that deepness in your mind, but also just gonna be. And Naomi was talking about, if I'm going to be healthy, or unhealthy, I'm not going to lie to myself about it. Hey, I'm just being unhealthy. That's okay. That's a choice I'm making. But society and Western culture, like Doc is touching on, tells us we got to accomplish, we got to push, and so that's that outer mind, as opposed to digging really deep into what our process is and sitting with our emotions and being okay with who we are and who we are, so that it can reverberate out and we can get the help and assistance.
I totally agree with that. Yes, I think thanks for explanation of that. But I think so many is, I think in today's society what is happening is two things is when it's given to us, taught by people, okay, do this, and one is the internal process. It was very nice to say that you teach a child 2 + 2 is 4. If child is not taught 2 + 2, doesn't matter, that child will never know 2 + 2 is 4. Very simple, right? So that's what the humans teach the child. But child knows how to get angry, child knows how to cry, child knows how to ask for food, everything. So he knows everything except 2 plus 2. So there are two ways of learning in life. And one is called from the internal nature, which is your internal nature, which you learn. All the emotions, the anger, the crying, asking for food is internal, right? You don't have to teach the child at all. He'll come and ask for food and you will eat and he eat the person. But 2 plus 2, what is maths, what's science and everything, you have to teach them. But let's just say the internal mind, which is the one which is the conflicting the thing. Once you stabilize the internal mind, let's say you say 2 plus 2 is 4 and the internal mind says, no, 2 plus 2 is 5. Then the whole world will become a chaos. Because then when internal mind is conflicting with what you're teaching, that's where the chaos comes. The fortunate is so it's the internal mind which has to be settled in the desire, everything. The internal mind, you have to work on your internal mind, not the outer mind. And that's where it is. Once the internal mind is calm, quiet, and understand, the whole process becomes very easy then. So, Tarabak, you had a question?
No, this is, as educated, fascinated with this. Where would you recommend? Because I'm not sure that.
Well, I think I just put on the morning, different YouTubes and look around and I listen to some theories and there's a Lao Tzu, like Chinese theory, psychologies and everything. So I'm very interested. The first morning, 1 hour of my morning, while I'm just getting ready, I listen to all these crazy thoughts, psychologies and everything. But I think I look more into the mind, because conscious mind and subconscious mind is very important. I think if you are very conscious of the moment, the time, this second, if you are very cautious of this second, I think the life will change, because all you have is this second. That's all you have. What you are thinking in the past and the future, you don't have anything. Future and past, nothing is here. This is the only second you have. And in this second, you are sitting in reality. You're not dead. So you are not dead. You are in this present time, reality, and this is all you have. You only have two options. Either you make the best of it, or you make not the best of it. So this is the only way. So being conscious of the time is a very important aspect. Be cautious of the time. My God, I cannot waste this. What is happening is, I think what we feel is, we have already made an assumption, I'm going to live 90 years old, at 85 I'll do this, 75 I'll go for this, 65 I'll do this. We have proportioned the life. So if you do, but all we have is this moment. Once you start looking at that, oh my God, this is the only time I have, you will start doing things very fast. And every second you will spend, you will be very cautious to spend it very nice way, because you can't afford. Tomorrow you may kind of a thing, you don't have that moment. So this is the only reality, that this is the presence of your reality, this moment, this time, this second, and be conscious of that. If you are, whatever you're doing, of course you want to do the best thing, right? Because it's going to be the whatever you want for the best of the life. So when you become cautious of doing the best thing in that particular moment, in that particular second, whatever you want to do the best, the life will become the best. So. Yeah, I have talk about, I think we haven't listened to it.
Quantum physics.
So this is an opportunity I wanted to grab really fast, because when we have our meetings and we discuss what to do, how to do, where to do, why to do it, who to engage in it, we don't have all these brilliant minds here, or all together at the same time, so we can get that synergy going. So we have a certified life coach. I think we have 2 now in this room. That's never happened before. We have Miss Naomi. We have Dr. Bag. We have Mr. Lyle. We have Dr. Case. We have Dr. Gotham. We have Dr. Leo. We have Dr. D. And Diane, who's our nurse practitioner, all sitting at the same time. It is profound to see that all these minds come together to make this event take place. And we're grateful to the college to entertain us, to allow us to help them to do that. Thank you very much. It's profound. And today we had elementary here, we had high school students here, we had senior population here, we have our active doctors who run this community here, who strive every day to make the difference in somebody's life, even one person's life. It starts with one, everything starts with one. So we've had people come up and say, I'm afraid to talk to doctors. I don't like doctors. I'm like, what did I do to you? I've not done anything to you. Not yet. Not yet anyhow. And we turn them over to different physicians to get a different perspective, whether it be diet and exercise. Like one patient turned to Dr. D and says, oh yeah, I like to press weight. I'm getting short of breath. I'm like, did you ever think about that? He goes, yeah, I did. I just thought I'd reduce the amount of weight I did. I'm like, not good. So I pass them on to different people, different doctors who are here to take these conversations so that we can share knowledge, but we all have a different approach. Leo has a different approach, Dr. D has a different approach, Dr. G has a different approach. We all have different approaches how we approach people. And this is why it's so profound that when we get together, that we can speak and interact with our community. It doesn't matter about who's patient, that we're sharing this information to take back. These kids have taken back something that will be profound to them. And they had so many questions. It was surprising the high school students didn't keep up with them about what they wanted to know about diabetes. And I know some of these kids because my son goes to that school. And I've lectured with these kids already. We're waiting. I want to take Dr. Case because Dr. Case is profound. He's been in this community for, I don't want to quote the wrong amount of years, but I'll say long enough that he's delivered a lot of this community children and has raised them. He's educated them on their health.
Delivered. That's the OB doctor.
Oh, that's the OB. Well, you've done the AFCAR. You've been in there in that room with them. So it's profound to have that kind of impact on a community. And I hope they always come back and say to him, hey, you were there for me. You were there when I was sick or I had this, stomach flu or whatever the case may be. With my staff, with these ladies that I work with every day and men that I work with every day, it's profound that as we sit with human beings and we drop the initials, we all suffer with the same thing. Did anybody ever notice that? We all suffer with the same thing. We all have the same thing. Insomnia, inappropriate diet, the kid pulling on you, the wife pulling on you, the husband bothering you, can't put that toilet seat down. We all deal with the same thing, so we're all human beings at that level. So irregardless of the initial, we all have the same syndrome. And if we come in together and we work with one another and we energize one another, it's profound, these thoughts that we have. Remembering there's that subconscious mind, the unsubconscious mind. I mean, we learned this as we were lecturing and doing the psychology and parapsychology and all these different courses. After a long time, I'm hearing somebody get to that level. We don't have lectures at that level. And the number one reason why we don't have a lot of lectures at that level, who's understanding it? You'll see some people are like, when are they going to shut up, man? I need to go. This is real. I don't understand this. I'm not digesting this. People have to be like food that we digest. That thought that's being put out has to be digested as well. If not, it goes to waste, like the rest of the food. So it's thoughts that we put together and the energy that we put to making this happen. So if we touch that one person, if we can convert that one person, not to anything, I mean, he's not going to dance in the street, beating a drum, selling roses, singing Hare Krishna, right? We're not doing that. We're just trying to get them to understand the concept. We want you to live well. Living well is better than living unwell. And one gentleman said to me, well, I have to die of something. I said, but you may not die. That's the problem. You have to die of something. I get it. But you may not die. Then what? And he's like, I never thought about that. And nobody's ever said that to me. Then what? Then you're a vegetable in bed. Is that the life you want to have? You're going to get bed sores, you're going to need wound care, you're going to need... Is that really what? No, I never thought about it that way. So it's these thoughts that we can cultivate when we meet these hundreds of people circulating. Though you really made me run today. And that was only not around this building, but 2 other buildings. Thank God I got a chariot the last time around. But it's profound. And I would just like to open up this conversation to all the intelligent minds here to say, what next? Because we're already planning for next year. we're already planning for next year. So what are we including? What are we doing? What do we do different? Anybody has any thoughts on that? Oh, I'm sorry, I'm asking the questions.
You say do different, what are you looking at?
Anything. I have a million eyes. I can look at it from any angle. What have you observed as an individual coming into this that you've seen that you would like to add?
I study a lot of Anthony Robbins, and I've been studying health a lot lately these last 3 years, so I'm big goal. And I've noticed that we haven't talked about the difference between acid, too much acid in our body versus alkalinity in our body.
I'm sorry, I don't like that thought. We're just, now can we go next topic? No, perfect. And that is something that Dr. Balcom can discuss with you, alkaline diet versus acidic diet in 2 seconds. But absolutely great thought, something that we do have to take into consideration in our diet. And somebody asked that question, how do we know diet? What diet do you do? There's a keto diet, there's a low carb diet, high carb diet, all this garbage that people try to complicate when it's not that complicated. What does your lifestyle call for? If you're standing or sitting all day, do you need 15,000 calories in your diet? Absolutely not. If you are an athlete and you're running and you're training and running that, 20 miles a day and bench pressing those, yes, your body needs more. So something is so simple as that, but it's now in this time has become so complicated, it's almost a joke. So I'm going to have Dr. Balcom touch on that. Yes, Dr. Case, I want to hear from you.
Sleep.
Dr. Case, really?
Oh, yeah.
It's called Lunesta.
Well,
3 milligrams, 1 QD.
But you know what I mean, though.
Absolutely.
People are burning the candle on both ends on here. That also includes one thing we've been trying to tell kids, which is limit the amount of time on these devices. I personally saw my daughter, she doesn't do it anymore, dead asleep, text goes off, she wakes up just enough to look at and reply to said text and go back to sleep. Well, that meant, that she woke up enough to respond to that on here. So it's not just getting sleep, it's sleep hygiene is kind of the current, term that's going around on here to make sure that our environment is conducive to sleep. And most of the time having these things or, tablets or other things is not conducive to that.
No, you're absolutely, Dr. Case. Can we tap on you to do that for our next lecture?
Work on it from a kid's standpoint.
Yes, absolutely. Well, we're grown kids too. People forget that we are kids. We have patterns.
Yes. So I would like to see, maybe psychologists, we have, if I maybe missed it today, but we have a hyphen, we want to be more aware of mental health. We have a big issue, and right now it's the time of year where we have a lot of students in K-12, and even at this level, that are dealing with their finals. There's a lot of stress, and we can keep them healthy, doing exercise, eating well, but the mental health is something that we really need to touch on, I think, a little more. And we're going to try to pack these chairs up next year, a little different, but I would like to see mental health come to us in this.
Absolutely. Mental health, like other vendors, were invited. Unfortunately, there was a no-show to the event today, which is very saddening because we here in Barstow have a beautiful community and a very receptive and forgiving community. They should have been here. Regretfully, life happened, so I'm not sure on that note why somebody didn't show up. I mean, we can literally, you have the greatest of the greatest minds sitting right here in Barstow that can touch on a lot of these subjects. We open the forum to bring in other people so there's no burden or strain on just one individual, because everybody here has an active practice and has actually shut down their practice so they could be here today. So we're extremely grateful for that. We know what that means because we also work. This is medicine, happens to be our job. So every individual here has shut down what they're doing for the day to be here to share that knowledge and share that experience in medicine. Regretfully, they didn't show, but next time I'm going to charge them a fee, so they will show up.
I think building on purpose isn't enough to invite, not enough to chat. We have to find a way to deliver what it is. That's certainly not get there, better understand. Talked about some of them already. Yes. Sort of rank what I think. We're going to work through that, figure out the psychology, mechanics, of reaching more people who are voluntarily. We can work with each other. So we have to figure out. Not enough to present. Where's wildlife? Not enough. Talk about high level thinking. Capture the minds of people. So that what we have to deliver is can be effective.
Well, I think we've done pretty good. I think for our second year in a row. You're absolutely right. People digest, as we digest food, we digest thoughts differently. And with the limited of time and resources, we, as a group, which the college has done a great job, especially my friend, what's her name? She reaches out like nobody's business. She's a dynamic piece of equipment. You think
Well, there's several of those.
there's a great team that comes together. Regretfully, when the invitation is extended, we leave it open. We never tell people, this is going to be your topic. What would you like to share? And regretfully, and I'll say it because nobody else says it, is that people forget where they start. And we always have to pay it forward. That's my philosophy, is take with one hand, give with the other. It's a philosophy my husband and I share together. The sense of community, the sense of sharing knowledge, the sense of building together. Because no war is won with just one person. It may be a great mind, but you need your soldiers. So we all function together. Dr. Case has always been somebody who said, Dr. Case, we have this. He may have plenty going on. He's going to pop out and he's going to be here. He's done it 2 times in a row for us. Dr. Dazan is here. He was at the hospital doing stress tests. He made sure everybody was sound, tucked in, and he came over because he knows this is a community that's supporting him today. Leo, Diane is new in the practice. So we're doing healthcare. Okay, we're there. Dr. Galton, you don't have to tell him twice. This is what we're doing. When I got married to him almost 13 years ago, he said, I tried to sell him on Jersey. I was trying to, Jersey's a great place. You got 4 seasons, lots of places to see. He said, this is where I need to be. This is where the medicine is not great, and this is where it needs to be supported. So hence, I'm here with him on that mission. So I've made it my business for almost 13 years to keep penetrating this community, keep penetrating and keep digging your way until we get to the core and we can start working from the core up. So not from the outside, but from the inside out. We want to see what's the problems here. Why do we have these problems? We work with PD, we work with the fire department. Not only here, we work with the community to find out what's going on and how can we fix it.
Within the mental health part also is family dynamics. There's so many dysfunctional families, actually everywhere, I can tell you that much. So Barca doesn't have the corner market on that. In our office, we get crossfire happens in there because of that, and these kids truly suffer. And some of these kids who are in these screwball family dynamics end up having the mental health problems because of being in the crossfire on there. And so a lot of times when you see functional versus dysfunctional families, so within the mental health, having someone talking about family issues, and if everyone, knowing that every year 3 kids are all in college, on there, it's not easy, but it can be done. But it's not just something that, we can just wave a magic wand and do. And so other people need to hear and know how to do that and how to, on their own, set a good structure for their kids. So then the kids can grow up, be mature kids who have goals that they set in the future on there. And will they have stresses and stuff? We don't know. But stress can make some people better, and stress makes other people worse. It's how we respond to it. So we need to look at how we can get into the family, get into the relationships and stuff on there, and how that sets thing for the whole community out here.
Yeah, I was already started working with that with the high school, and we had parole correction officers and so forth there, trying to change the dynamics for these kids. And then, Dr. Gautam was approached, there's food banks of different things, children not being able to get food, or they won't get to eat over the summer, and all this kind of stuff. And when you deal with these matters, you have to get into the house. And when you try and get into the house, that's when they say, whoa, how dare you tell me I'm a bad mom or a bad dad? and we get it because, somebody said to me, you're not a great mom. I'd be like, what are you talking about? My son has not left my hip from the day he was born. So everything's relative, stress relative, good parenting, bad parenting. We've already talked about having seminars and putting the thought processes out there about stress management and signals and what are you teaching your children? It's not what you say, it's what you do. Children are not unintelligent. Children are the smartest people that's going to be around because they have nothing to do. But they're watching everything you do and they know how to respond. Oh, have you ever done this? We are adults and most of us have children here. Have you ever sat back and seen your child do something and you're like, oh my God, that's me?
Yes.
I've been doing it lately, and sometimes I look at my husband and say, is that me or you? Is that me or you? Where did you get this from? And you start thinking back to your child, and it's like, oh my God, is this me or you? And you have to teach your child, no, this is okay for mom because mom does X, Y, and Z. You're not X, Y, and Z yet. You don't get to do that. So, and Mr. Kyle, who trains my son, has to deal with a lot of that. I'm sorry, Mr. Kyle, I apologize. It is probably me. Please.
So, I'm just an observer on all this, but what I see is a room full of people that help and people that can be experts or whatever you can see, preaching to each other, and that's not doing anyone outside any good. So I think the priority over what else can we talk about, it doesn't mean a damn thing if no one's going to hear it. The priority should be
Well,
how
here
to
it
get
is.
people in here.
Here it is, you're right. But this is the opportunity we have where all of us are sitting together to plan and how we're going to reach out there. We've already made attempts to get into the high school and they welcome us. Get into the college, they welcome us. I've started with the elementary schools. Some have welcomed us, but it has to go beyond, like Dr. K said, and Dr. Mr. Lyle said, that we have to get into the homes. That's the tough part. That's when we have these minds, we can talk together and find out, how do we do this? You may have an idea that will work better than mine. I don't know how to do that.
I love that you asked that question to start off this point of need the psychologists and therapists. And when I found out that this was happening and kind of put my group, and we had a lot to have to back out because it was a last minute request that I had teeth to come back and jump in and get back. And I think it's a combination of Barstow's and the Louisville. And I just tested the pulse with the student athletes. Not all of them even knew there was a counseling center on campus. I played baseball here. When I came and visited a couple months, I went in and they were rude to me, a fellow clinician. And when I contacted the clinicians, who I'm sure you guys contacted in this area, I hate to bash it, but I was less than impressed. Not just with clinical ability, but the lack of willingness to come and do something like this. To share that with their patients and let them know to come here and talk to doctors and healthcare, to come and talk to other health professionals. And I think it is a play most of the time. I grew up in this desert. I'll say it out loud. I think the high desert sucks when it comes to I really do. It's why I come back as often as I can. It's why I bring you into my lab connect doctors, because that question is, how do we get those professionals in this building? But also at this point over here by the fine gentleman of it's all for nothing. Families.
No, I don't believe anything is ever for nothing. Where there's a profound thought, there will be action behind it. Not by maybe every single person here, but it takes one. Everything starts with one. That's my philosophy. It was not very easy. This has been a almost 13-year journey for me. So I stand here proudly to say, knowing squat about the high desert, being raised in a big city. I've never lived in a small town. Now I understand the limits of a small town, and it scares the heebie-jeebies out of me because above anything, I'm a human being. I'm sorry, if I go into cardiac arrest, I'm not resuscitating myself, right? So I'm like anybody else, it doesn't matter what my skills are, I could diagnose myself, I can't treat myself. I have a son here. My son suffers any head injury, he has to be like any other person's child in here, airlifted to Loma Linda. I'm not happy about this situation. But I've been one woman with a husband fighting this fight with him to make bigger and better things happen for this town. And now we have the corporation of a great CEO who actually came out today to meet his community college. So that's an action right there. It's steps, and we're taking those steps. Our physicians are getting older. They're looking at retirement. If they were to retire, we'd be the only two standing here. But we are taking, as a husband and wife couple, as professionals and conscientious community members, to make that effort, to reach out, to help recruit, help the hospital do what it needs to do, help the local PD do what it needs to do, help the local community college or the local schools do, but everything starts with a thought. It starts with a thought, and there's going to be action behind it, but we need help. So hence having all these great people in one room has given me the opportunity to say, what next? We reached out to, and again, not to be derogatory about anybody, like you just said. We reached out. The invitation was given. The encouragement, the follow-up was done. Yes, Dr. Welcome, I'll be there. Other than short of putting a low jack or sending a bouncer to go pick him up and bring him over here, we did everything we could. Unfortunately, there may be life situations. I had a profound guy, great guy, was supposed to come out. They had a family emergency with their child. But he sent his staff here. He sent some raffle items for us.
Your point earlier, sticks with me. Much of that is so.
Chipping away to the night.
The idea that we're building on something this year's improvement in terms of significant improvement. We can't lose view of that challenge to address how we improve things. A lot of parts to it are very complicated, but we continue to move it forward, continue to engage the community, continue to engage our employees, our students. So it's enormous amount of work to do, how we structure the process, the distance between here and the facility, what that do in terms of the arrangements, a lot of stuff to think through. But what's happened in the last 2 years for my personal
It's been profound, thanks to you guys. We're all blessed to be part of it, and we're gonna step up big. It's like a child when they take their first step. You want to record it, and you're all happy and excited, and then they take their 2-3 steps, and then they keep running around without falling. You're like profound, and then they take the 1,000,000th step, and you're like, okay, so what else is new? We're not going to do that. We're going to keep developing. And the great thing is, I've done a lot of big shows, and every show got better. Every performance got better. It got swifter. It got more integral in performances and the lights. We're going to do the same thing here. But like I said, we have these superior minds all sitting here together, which we didn't have in any of our meetings before, right? You're going to put a low jack and zap them when they don't show up. But on the good note is now we have an opportunity to speak as individuals. Forget the initials, as individuals. Things we want for ourselves, things we want for our community, things we can contribute, or people we can reach out to contribute, who would be happy to do that. So a lot of it included a lot of little, hey, Starbucks was here. That was profound for me, I'm sorry. That was good. And look at the thought process. The manager sees, this is my community, I'm gonna be there. These are the college students who come to me. These are the professionals here that come to me. These are whoever that comes to me. And they were able to call people by names. They were able to put posts on Facebook saying, who's your favorite? Because they knew everybody by name and they knew their drink. It's profound. That's great. So from the most superficial level to the most profound level, we're gonna hit. Dr. D, you have any ideas for us?
Partition. I mean, I was surprised to see the kids here, and that was kind of nice. It was refreshing to get more people here. I mean, I think we can tap into the senior center. They're down the road. You know, Leo and Dr. G are always up at the VA. We can always say, hey, listen, no VA patients, they need to come down here. Half the time they're just sitting around doing nothing.
We could have done stress tests right here.
Yeah.
It was done.
You know, that's,
We did. We
having
did.
the school kids and the high school kids, that's fine. I'm not too sure about the college. I think I see some students, but you know, part of it, Alan, is the alumnus here. This college, I'm very impressed with this community college. I mean, you don't know where you got this area here, and it's just like a gem, you know, diamond in the rough. So I like this. It's been nice to see some. I guess I missed it, some of more of the college students, but it's only college students. One gentleman said, "What's all does it take to get to where you're at?" You know, all you get one person, you tell them your life experience, and say, "You do this, you may get to the point that you want to be in." This it takes one person, and that spreads out. So there's other things here within the college, the senior center, the VA, and schools is great. Now, in regards to the professional physicians, that's hit or miss. But Alan, he can bring in more people from his area for mental health. I mean, you know, mental health professionals here, they can't make it. You have probably a vast reservoir where you're at. And I guess that's the deal where people want more mental health. I really enjoyed your lecture, really did. I mean, I'm very much impressed. And that's something that I deal with. And when I see patients, 80% of them I can handle that what they have. But because of the 20% of mental health, and I'm just at a loss. And all I can do is just be empathetic and supportive. But I don't have those resources. And that's part of it. It's not their disease, it's the disease that's overwhelming their daily lives, but the mental aspect of that, that's what they need help. So we can get more people on the health committee, and just have to remind them. I'm not too sure about professionals. I mean, I can ask my brother in LA, you know, he's a physician, you know, we can get like some guest lecturers, and we can get guest lecturers that they can come in or so. We can even look at that. We know, as physicians, we know some people who know people, or they can at least invite them and say, hey, can you come out for like 40 minutes of your time and just talk with that community? So.
And that too, we had a big group, there's 8 of us initially, because I found out about it. They all have to talk.
Do you mind if I ask you how to sign up?
Through Rachel.
Through Rachel, okay, okay. This is good to know because I didn't even, like, some of the vendors, I didn't even know they existed, so I had my girls go and pick up a card from each person, and I tried to make the time to talk with each person to see what component do they deal with.
I absolutely love this, because like I would talk to Rachel a month and a half ago, just from the standpoint of like, I want to get back and talk to these baseball players, because I know what it's like to be depressed, living in Barstow, playing baseball.
Well, Barstow doesn't give depression.
No, sorry. To talk to these guys and gals, and you know, and I would love to coordinate you with you. I know hundreds of clinicians there. I know at least 20 of them off the top of my head. If I gave them a call and asked, they would probably hop in the car with me. And I grew up in this desert, so I can pull hundreds of people. So I would love to just coordinate.
Well, I'm going to take you up on that. I'm definitely going to take you up on that. We would even go as far as even housing some of them if they have the time to provide services here. Because the past 6 months, me and my staff have been working on that. When we see that patient coming in complaining of depression or anxiety, etc., Leo and I deal with this a lot. Where do we send them? And you send them to a mental health professional, and they say, oh, it's 4 months to get in. What do they do in that 4 months? What do we do with them?
This is something that I would love to challenge you, because there are a lot of things we can do, and I think in this area, there's a lack of information with the clinicians, because, you know, down the hill, Orange County, it's like impacted, so you have all these resources, all this information. The further you get kind of just into these lower population areas by design, I think, and by kind of just sort of structure, there's less mental health services, therefore less knowledge of resources, even with things like Google that you can. But those are things where like I can bring a group of clinicians into it and here's to get that information.
That would be great because we need that here. Being in an underserved area, we deal with this all the time. That's what we've been fighting for 13 years. 13 years. I finally got a cardiologist. That's how long it takes. Oh, sorry. Well, that's good. Now I'm gonna hold you to it.
Yeah, I think I love what Lyle said, that we're going to just continue to get better, but I think that coming around to next year, we need to get more people that's on the committee that's involved with the inner of creating this and putting it together to promise that, like you have this, I think you had something to do with this school here.
Yeah.
Okay, so you brought them here at the right time, they knew when to come, they knew when this presentation was happening. We need to get more like me. I'm a school board member. I can promise that I will bring 3 classrooms here. That's what we need more of. We need somebody to say, this is what I'm going to bring to the table and bring it. Because we need to get those high school students in here, just like the elementaries in here. And we may think, even at Forest College, may think about not doing it on Friday, because we have very limited classes on Friday. Most faculty are not here. If we could do it on a different day, maybe a Thursday or whatever other day, we can get those classrooms here as well. Because we really need to reach out to everybody, but we need to say, this is what I'm going to do, and not just an empty promise, but we pull through. You did it with this school right here. So, I'm all in, and I think that we can get more people that will be all in, because we want to spread that word.
I just don't want to take undue credit. It was divine intervention that they happened to show up at this time, and I grabbed them and I said, come in. And at the same time, the high school came in, and I'm like, you're coming in also. Because it was profound, and I really think it was divine intervention that the elementary students were here, the high school students were here, and then we're at the college. And I thought this was a great time to just grab them and say, hey kids, this is where you need to be. You're in the elementary, you're gonna go to this side of the room because you're gonna be at high school, and yes, you are going to be in college. At least that's the message I was sending to my son and some of his friends that I know that would go to college. So it just happened that way, but it was nice that we were able to talk to them. Now we've gone to the school, Ms. Naomi and I have gone to the Marshall Christian Academy, and they've opened their doors to allow us to talk about diet, nutrition, and changes that are going to be happening at their age. The high school is always invited us, I hope 2-3 times a year, to talk to the kids over there at the high school level, and they're always there. They have a counselor over there that's always willing to work with us to do things, suicide prevention and stuff over there in that school. So it's nice to get everybody together, and we're able to have these talks because it's not, they're part of the community. They are the ones that are going to take the community to the next level. So when I was at the health fair, is when I reached out to Mrs. Bradford and said, how about this? And she teaches right here, so it was no better thing. It was very easy for her to come. And then inviting the high school for the same thing, come on out. We invited other schools. Maybe we just need to follow up better with them and see. And I know there's a liability issue and all that kind of stuff, but they worked through it, so I don't see why we can't.
You may want to check the date next year, if you do it next year, for when state testing is, because I know it's going on. And I know that they put an enormous amount of pressure for performance on the state testing. So that you may want to look into the date compared to when state testing is on there.
Yeah, we used to do this just last year, remember? We just graduated, so yeah, stuff we didn't do.
How hard would it be to take all of this and turn it into maybe a presentation at the high school during an assembly or something like that? Or you don't have to worry about maybe someone shows up, the whole school is there. And then even if 80% of the kids don't care, maybe the ones that need to hear it, that wouldn't come out here, it's there for them.
We just had this conversation with the 2 teachers and Ms. Negretti, who sits on the STEM board and at the high school, because they're the ones that call out to us. So we have no qualms about doing this. We didn't get to talk after this, to go to them. And they were just talking about if we would join with them to do a health fair at the high school. So that's what I was going to meet with you guys. We just had this conversation before I came out here.
Cool. And
I tried to get them back.
I just had a conversation with the superintendent, and we were talking about, I was asking, this is the time we need to reach out to those high schoolers. This is the biggest pressure that they're facing right now, especially the seniors. And this is the time, the best time to go and talk to them about all of it. I love what the doctors had to say. They need to know what the monsters do to their hearts. I had a nephew who his heart had to be re-jumped because of all the monsters. My children's own father committed suicide. We need more people like you in this room, everybody in this room, to reach out to our youth so that they know what the risks are of everything. And if we don't get out there, we're doing an injustice to our future.
No, you're absolutely right. And in those lectures that I've done before, we've talked about that. The teens needing the help, what vaping does, because now, anybody underage can go and get it done, like that you all failed chemistry because you forget chemical compound at room temperature and then heated now becomes something else. The molecular change has already happened with that heating. So if you guys don't see that, we need to go back to chemistry 101. So we've had these discussions, especially with kids that they have in their school that want to go into the medical field, that want to be the future doctors or nurses and surgeons and respiratory techs, ER techs. We have this conversation and they think, you can see that light go up. And the ones who are really interested are the ones that come right after and say, can I have your phone? Can I have your phone number? We actually have given our cell phone numbers to these kids where they can contact us, where they can have one-on-one with us. Hope they're not selling any longer. But we've done it, but this is an opportunity we haven't had in a long time. And maybe at our next meeting, I know when we have meetings, it's hard, everybody has wives, children, husbands to get back to. But if we can do this on a bigger scale with you, Mr. Kyle, I'm going to hold you to it since you're already at college, and Dr. Case, and see if we can put a program together where the pressure's not on one person,
So
but we can share the love.
if we have a year, we're talking about next year's.
Yes.
Then we'll coordinate to where we can meet up, talk about these things, and actually take the year to where it's not something rushed for a month or two. Take the time, even if we're only meeting up once a month, and actually put together a
Actually,
plan.
some people have had months and they still didn't show. And they thought it was appropriate to call me at the 9th hour.
That doesn't surprise me at all.
Yeah.
But the people that need to show up will show up. I think, like I said before, I wasn't trying to be negative. I think the majority of the planning should be on not what are we gonna say, but how do we get the people to hear it?
Yeah.
How do we go to them to hear it?
Yeah.
How do you guys advertise?
Right now,
Well,
it's preaching to the choir.
we're advertising. I don't know how the advertising was done.
I've seen
I
it on
reached out.
Facebook a few times, but a lot of the
Probably was
population
good.
are like, on SSI and disability, so they don't go on those to see that. They're not gonna be on.
But then I need somebody like you to say that.
Right, well, I was gonna say that. Like he said, a lot of the
I'm gonna take a bullhorn, I'm gonna drive down your street in your
Well,
car.
that's what I'm saying, or whatever it takes, these people don't know that we're having health care.
Oh, no, they know, we had a breakup today. Breakup means that we spread the health fair out because the last year, you know how it was, there was a lot of people in here. And it was him manning the podium with all the guest speakers and me circling this building. Now we're trying to spread it out, which was probably not the best because we had breaks and nobody knew, or even though they had something in front of them, wasn't really paying attention to what was happening when, where, and how. So, but we flew with it. We did the best we could. People who said they were going to show, didn't show. Okay, I got that lecture. I'm educated. I can do this talk. Do you see what I'm saying? So we were filling in the gaps. But now, next time, I'm going to see you at the meeting.
Yeah, because it's already like the patients that already see us, the people who are going to come to us, like we need the people who don't know that we're even here.
But
We need the
those
people
are
that
people
don't
who may
care
not
about
want to come. See, because they've done the newspaper, they've been doing the radio, it's been blasted a lot of places. So I'm going to come in with a little bit of defense to say that this team has done a fantastic job of getting the word out there. It is not easy to pull this off.
Well, the people I speak with, they didn't even know there was a health fair at the college.
So you tell me how to get to them. How do I get to them?
I think that's what we meet about. It's not about.
I wouldn't
blaming
solve
or
it
saying
now, but
anybody failed.
like,
Well, let's
have a
talk
meeting
about
and
how
talk,
to
yeah.
do that.
Well, I didn't even know that they didn't know. Do you see what I'm saying?
Yeah,
That's
right.
what I'm trying to ask you.
And
It's
it's
like, how
more
do we
of
go?
the, and I don't wanna say it's more of the SSI and disability people, but those people are showing their kids that that's how they live, which is not good. We need to get up and go to work every day, like you're getting up and going to school every day. Just because your parent does that doesn't mean you need to follow those steps. those are the kids that we need to really, and the people, but those ones aren't even paying attention to us, because we're over here, they feel like they're over here.
Because we.
But that's just me,
Right.
because
But we don't go home with them. They won't let us.
right, like he said, but there's ways that we can try to get in that door.
You take the
For the kids.
applicants on this campus, they're passionate, young, and hungry, put flyers in their hands and send their ass.
Exactly.
I think, you know, and I can cover the public of baseball players and guys and tell me.
Mr. Lau, did you hear that?
Yes, you just have to get a license to do it with the city, that's all you have to do. But yeah, if you get people go, you know, even door to door, and you do Facebook, and you do all these things
Yeah,
too.
but I barely seen it on Facebook, like today and yesterday, and I'm like, people already have plans.
Yeah.
I'm just saying, doctor, I know, don't kill me now.
Cancel this one.
But yeah, you should probably have a meeting in about a month to go through this and to already start planning next year.
And I did run it past Dr. Bag, and I'm gonna say it again, is that when we were trying to pull people to come in to listen to this invaluable, information, it was packed where the foods were, where the food carts were.
Didn't I tell you?
And what
We
I
should
would
have brought
like,
the donuts in
so
here.
what I would like
Right.
to suggest is next year is that they have to come here first, and as they go out the door, we give them their free meal ticket. But they have to come here first, then they can eat. So bring them in and then send them to go eat. So I think that that would work as well, just the way we channel, how much people were down there, and not a one of them, when I went to go inform them this was happening, nobody moved. They were
all by the taco truck.
Exactly.
I saw that.
Exactly. It was that, so we're just gonna have to channel a little better.
Keep it there, it's more business for me.
Right, you guys just talk by the taco truck.
Listen, okay, but I appreciate you, appreciating us and allowing us in. And as we move onwards and upwards, we're gonna get this fantastic. And Catherine has already volunteered to do bullhorn down the streets of Barstow.
There's a no, there's a helper next year too, all the people.
This is what it's for, it's the community. And we're gonna do it bigger and better each time. But thanks to all of you for giving us this opportunity, for tolerating us and our iPhones and our, with me. See?
Thank you. Thank you.
All of you experts here, your passion, your commitment to this community. The moment I met you, it's like, this is a woman of force of nature. You're obviously quite a dynamic pair. I mean, when Dr. Don was talking about living in the moment, seizing every opportunity, you both do that. And you take in, this opportunity, this college, you can morph to the community to meet the needs, but it takes that willingness, and really it's just a love that you've obviously demonstrated to this community. So you're an inspiration to all of us. From the bottom of our hearts, thank you all for your time. It's so valuable. We appreciate it so very much. Alan, just met you and your team. Oh my God, I was so moved, and it's so wonderful to hear how you've taken your small time here to do such good things for people. All so much. Thank you.
Okay.